Good morning, everyone. I kindly request everybody to mute yourself and switch off your cameras. Good morning, everyone. The webinar is about to start. A warm good morning, ladies and gentlemen. Today we mark this date as an event to help us all lead a healthier lifestyle. I am Ponmuri Narayanan, lecturer in clinical nutrition. It's my pleasure to be the host of today's informative webinar. Now, on behalf of faculty of AHS, Dr.M.G.R.E Education Research Institute, we welcome you all to the webinar entitled Importance of Nutrition in Preventing Cancer on the remembrance of Cancer Awareness Day 2022. So before we get started, I like to go few items so you know how to participate in today's event. You will have the opportunity to submit all your text questions in the control panel, which we will address at the end of the presentation. You can send in your questions at any time of the presentation. So at this time, it's an honor to invite Dr. Bhavani, Vice Principal, Faculty of AHS, to begin the session by delivering the welcome address. Welcome you, ma'am.
Yeah, a very cheerful morning to everyone present here. We Faculty of Allied Health Sciences, Dr.M.G.R.E Educational and Research Institute have organized a webinar on importance of nutrition in preventing cancer under the benevolence of our Honorable Chairman Dr. A.C. Shanmugam Sir, our Honorable President Engineer A.C.S. Arun Kumar Sir, Honorable Secretary Thiru A. Ravi Kumar Sir, and respected Vice Chancellor Professor Dr. Kida Lakshmi Madam, Registrar Dr. Palanivel Sir, Dean Dr. Pragna Dolia Madam, Medical Superintendent Dr. Palanivel Sir, and our Director Dr. Kalavati Victor Madam, and our beloved Principal Dr. V. Kalpana Devi Madam. The main aim of this webinar is to create an awareness on importance of nutrition in preventing cancer among everyone. It is also important to dispel the myth that people wrongly believe and inform them about the signs and symptoms and importance of screening for early detection. It is also vital to follow a healthy lifestyle along with a balanced diet and with a nutritious food and sharing of survivor stories. It always gives a message and hope of confidence to everyone. So, in this glorious moment, I extend my warm wishes on behalf of Faculty of Allied Health Sciences. I just want to convey my heartfelt gratitude to the speaker, today's speaker, Ms. Haripriya, RD, MSc, CDE, Executive Nutritionist, Cloud9 Hospital, OMR, Chennai, for presiding over this webinar on importance of nutrition in preventing cancer. Last but not the least, I once again welcome all the participants, my dear faculty members, and all my students to just have a knowledge in this webinar. Hope everyone will enjoy this. Thank you.
Thank you, Bhavani ma'am, for being with us today in your busy schedule. So before moving on to the session, I'd like to introduce Mr. Jaffer, the marketing manager at Cloud9 Hospital, to just give a brief explanation about the Cloud9 Hospital. Over to you, sir. Sir, can you please unmute yourself and speak? Yeah.
Thanks for the opportunity. Yeah, good morning to everyone. Myself, Jaffer from Cloud9 Hospital, Chennai. Cloud9 is India's leading maternity hospital. It is first chain of maternity hospital founded by Dr. Kishore Kumar. He himself neonatologist. He was with Australia before. And we have over 23 branches across India. In Chennai, we have two branches. One is at OMR, Old Mahabalipuram, Thuraipakkam. Another one is in T Nagar, Vijayaragpuram. So, importance of nutrition in cancer prevention is it is a very good topic, Ed. And thanks for opportunity given to Miss Haripriya. Over to Haripriya. Thank you so much.
Thank you, sir, for sharing the information about the Cloud9 Hospital. Now I would call upon Ms. Annie Anbarasi, lecturer in clinical nutrition, to welcome the speaker of the day.
Ma'am, you're on mute.
Annie ma'am, can you please unmute yourself? I think there's a technical glitch. Just.
Sorry for the delay. Thank you, Ponmori. I'm privileged to introduce our guest of honor, dietitian Haripriya, MSc registered dietitian. She pursued her graduation and post-graduation in the specialty clinical nutrition at Sri Ramachandra Medical College, followed by her clinical fellowship at Tamil Nadu Multispecialty Hospital, Omandu, Chennai. And I would like to share few of the certification and achievements of the speaker. She is a certified diabetes educator, certified infant and young child feeding trainer, a registered dietitian from Indian Dietetic Association, have been awarded for the topic The Effect of Chia Seed Supplementation in Overweight Adolescents at Wales Institute of Science, Technology and Advanced Studies. Have presented a case study on the topic Nutritional Intervention in Cancer Buccal Mucosa in e-launch of Special Interest Group in On-Food Nutrition by Indian Dietetic Association. Have conducted many nutrition sessions for the Special Action Group Police personnel on basic nutrition for optimal health and exercise nutrition. Currently working as executive nutritionist at Cloud9 Hospital, Chennai. Over to you, ma'am.
A very good morning to everyone present here. Thank you so much, ma'am, for the kind introduction. So first of all, I would like to thank everybody and thank Dr. M.G.R. University for giving me this opportunity. So it gives me an immense pleasure to be a part of this cancer awareness program, and I wholeheartedly thank Dr. M.G.R. Educational Institute and Research, Faculty of Allied Health Sciences for giving me this opportunity. Special mention to the Principal Dr. Kalpana Devi and Vice Principal Dr. Bhavani and Ms. Ponmoli for having me here, and also all the faculties and dignitaries who are present here for this session. So, shall I start sharing the screen, Ponmoli?
Yes, ma'am. You can start.
Okay. Is it visible?
Yes, ma'am. It's visible. You can start the presentation.
Okay. So, as we all know that today's topic is on importance of nutrition in cancer prevention. Okay, so last week on February 4th, it has been identified as World Cancer Day, and the awareness programs are conducted for a week. So this year's the theme of World Cancer Day is closing the care gap. Okay, so before knowing about the theme of cancer awareness program, the main thing which I wanted to tell everybody is that before, during ancient times, there is nothing called as these kind of deadly diseases like cancer, or even don't know what are the types of cancer which is present during that time. But as of now, if you see, there are more than 100 types of cancer, and even now they are, with the help of the research, they are inventing new cancer types, which is really deadly, and this affects the quality of human life, right? So this closing the gap of care gap is basically giving a proper nutrition support plus the proper treatment for cancer. This should be reached for all the socioeconomic status people. It's not like only the higher people can afford for the cancer treatment. It's not like that. So government has give more importance by starting trust, or by starting government setup or hospital and college come hospital to help the people who are middle or low socioeconomic status people, to give equal importance on the treatment of cancer. So moving on to the topic, it's basically the importance of nutrition in cancer prevention. Anything, this is, everything is human made. It's not like a kind of exposure or something which is a communicable disease or something like that. It's what we have made, that is what the impact of this cancer, right? So cancer is one of the world leading cause of death, and its burden is still growing. So if you see in 21, the world has crossed the new threshold that 20 million people have been affected with cancer, and more than 10 million people are dying by today. So if we roughly say 1 in 5 men and 1 in 6 women are developing different types of cancer during their lifetime, which affect the quality of life. So these number will be continuing to rise decades ahead, and yet all the cancers can be treated and many can be prevented as well, right? So this prevention part is what we are going to focus for today. So moving on to the basics of what is cancer, what are the causes, or what is the etiology of cancer? Why is this, really very deadly for the human body? So cancer is basically a group of diseases which is characterized by uncontrolled growth and spread of abnormal cells. Okay, we all know that this cancer, if any one particular carcinogen or the cancer causing agent which is inhaled or which is passed inside the body, the first thing happen, the changes which happens inside the body is initiation of the cell. So initiation is basically getting exposed to stress, which is free radical scavenging, or other radicals, free radicals which we are exposed to, that causes inflammation in our body, which alters the cell membrane, and also it alters the DNA. Okay, so after this, what happens? So continuous exposure to all these free radicals and stress causing agents, inflammation, so prolonged exposure to all these causes promotion of cancerous tissue. That is, it signals all the cells, and that will get affected also. Okay, and after this it causes progression. Progression is basically it is also called as metastasis of the cell. So progression is the final stage where a cluster of dead cells form together and it forms a cancerous tissue. So this is what basically how the cancer is formed. So so what we can do is that we need to identify the possible risk factor and the possible cause of the cancer causing agents. Okay, so basically we all know, everybody knows that tobacco, smoking, alcohol, and excess weight and other food causing carcinogens will leads to cancer. It can be anything. We have numerous cancer which has been introduced, like CA buccal mucosa or esophageal cancer, gastric cancer, or intestinal cancer, gallbladder stones that might lead to cancer, and many more, right? So here I just wanted to share a small story. When I was doing my internship in government multi super specialty hospital, it was like we have seen many cases, like even in Ramchandra we have seen many cases, cancer cases like gastric cancer, which is more prevalent in Tamil Nadu. And even that cancer, we can see more of a low socioeconomic population getting affected, even the women who are getting affected. So one case is that a 45-year-old female who came with the complaints of pain, severe pain in the abdomen, vomiting, loose motion, or severe diarrhea with dehydration and bleeding. So everything was there. And after that, when we will collect nutritional assessment and nutritional history, right? So in that we identify that she used to take more of refrigerated foods, like storing the food for a longer period of time, because they will not cook then and there, right? So they will store the foods and they will eat more of wastage foods or something like that. And also more salt intake, they will preserve everything, like even the rice they will put salt, or even the thing they will add more of salt, include more of pickles in the diet, papads in the diet. So that increase in sodium level, increase in salt intake per day, that will leads to gastric cancer. Okay, so today, as like around, I think more than 100 people are there. So just take a pledge that you have to tell at least 5 people in a day that they have to avoid high fat, high sugar, high salty foods. That is to avoid HFSS foods. This is the major cause for all the types of diseases. Like it can be diabetes, it can cause obesity, it can cause to all the types of cancer. Okay, so even if we are exposed to other exogenous factors, if we prevent all these inclusion of high fat, sugar, salty foods, 80 to 90 percentage of the risk factors will be reduced. Okay. Alright. So if we see the prevalence in India, it has been more than 1 crore 39 lakhs and 2,179 cases for the year of 2020. And the common 5 leading sites are breast, lung, mouth, cervical cancer, tongue, and also the gastric cancer. So they have given a beautiful bar graph of the difference between the male and female. What are the incidence of cancer, types of cancer which is prevalent? The first in female is the breast cancer. So we all know that breastfeeding the baby, continuous breastfeeding for at least 2 years will prevent breast cancer. So we all know that the progesterone, estrogen, which is produced during the lactation period and also during pregnancy. So this breastfeeding will help the mothers to prevent breast cancer by 90%. So we all have to, as a nutritional professional, as a healthcare professional, we have to educate and create awareness among the lactating mothers to tell them that you have to breastfeed the child, whatever the situation it may be. Right? So this will prevent breast cancer as well as the cervical cancer in women, which is highest among the females. And among the males, it's obvious, like lip and oral cavity cancer is common. This is basically because of the tobacco chewing and pan and alcohol and all those things. So, and also, some bacteria or viruses may also leads to these kind of cancer. So this will be discussed in detail in the previous, future slides. Okay. So there was a Lancet study which has been conducted in 2018 and 19. So they have compiled the data between 1990 to 2016 and also 2020. They have told that there is a rise in twofold of the cancer risk in Tamil Nadu. Okay, so the 10 cancer which are responsible, there are many types of cancer. Okay, there are 10 top 10 cancer which are responsible for the highest proportion of cancer which affects the disability, which causes disability adjusted life in years. That is, if a person is affected with gastric cancer, then the nutritional status, the quality of life will be affected because the person cannot take anything orally, right? So they might put on NPO, or they might put some nasojejunum or jejunostomy tube. The feed will be through that till the cancer is either removed, or it can be treated with chemotherapy or radiation, right? So this can be 9% of the total cancer causes disability of adjusted life in years. So this gastric cancer, as I told you, removing high fat, saturated fat, trans fat, high salt and sugary foods from the regular diet will help to reduce the risk of stomach cancer. Okay, so this is what I told you. If you see, in 1990, the Tamil Nadu has been like 45 to 59.9 percentage of incident. But if you see as of today, 2016 and 2020, it has been increased. So there is a twofold raise in cases or incidents of cancer in Tamil Nadu. So let us, discuss about the causes of cancer. You all know that there is any chronic inflammation. That is what I told you. There is, prolonged exposure to environmental factor like pollution, stress, or the smoke which we are inhaling. Everything causes inflammation in our body, and obesity, obviously. And after that, type 2 diabetes because of the insulin resistant, overweight, obesity, sedentary lifestyle, inactive, physical activity, without any physical activity, and this causes weakened immune system. This alters your gut microbiota, which leads to damage in the epithelial layer that causes all your infections to pass through the lymphatic system, finally causing all the metabolic disorder, and that leads to weakened immune system, which causes cancer. Okay, and also poor diet. Having a very poor diet, having a very less in whole grains, fiber, micronutrient deficiencies, mainly vitamin A, C, D, selenium, zinc. These are the some of antioxidants which is really important for the day-to-day basis. Even today, just think of yourself, how many of you are having at least 2 fruits a day, or at least 2 cups of veggies in a day? No one, right? So this is the main causative factor. This can be preventable. It's not like we cannot buy or eat or anything like that. We can have, we have to separately give time for ourselves to improve our nutritional status, and include more of a quality diet, which is really important to prevent all these deadly diseases. Okay, so other than this, obviously environmental toxins, smoking, alcohol, everything will cause this cancer. Okay, so what are the exogenous? So in specific, what are the factors which causes cancers? Tobacco use, infectious agents which contains bacteria, parasites, viruses. The small example, it can be human papilloma virus, which is the main cause for the cervical cancer, and H. pylori infection, which is the main cause for the gastric cancer, and medications such as if the person have undergone any transplant, or if the person is on any anti immune suppressants. Okay, if the person is on immune suppressant, they might be prone to some type of cancer. We might not know, right? So, and other radiations like X-ray scans, or other radiation, harmful radiation like UV radiations or something like that, that chronic exposure will cause cancer. And other than this, chemical exposure such as polychlorinated biphenyls and organic compounds which is used in plastic paints and adhesive. Nowadays we're not using steel boxes, right? So everybody have changed to using Tupperware, plastic boxes and hot boxes. So what will happen is that there is something called as polychlorinated biphenyls, which is, when you put something hot in the plastic, the fat which is present in the food and also this polychlorinated biphenyl will react together. That will cause a carcinogenic effect in our body. So frequent exposure to all these long term exposure, you might get a cancer by 40 or 50 of age, right? So these things should be prevented, things should be avoided, and we can move to our traditional way of having lunch boxes. And other than this, carcinogenic compounds which are found in foods and beverages like aflatoxins. Aflatoxins is one of the carcinogenic metabolite. It's a fungal disease which is present in crops, whole grains, and all the dry raisins and stuffs. Okay, so this can be prevented. This aflatoxin growth can be prevented by proper storage of the food. Okay, and heterocyclic amines, polycyclic aromatic hydrocarbons are also important to and carcinogenic agent, which we can say that these chemicals are formed when the muscle of the meat, right, like pork or beef or any other non-veg foods, when it is grilled or when it is exposed to very high temperature of heat, this causes a black color, discoloration in the outer layer of the food. So that black color thing it is what that hydrocyclic and polycyclic aromatic hydrocarbons, which is a cancer causing agent. So it's not like grilled or smoked chicken, it's really good, rather than going for fried and tawa fried. It's not like that. Anything having in excess, anything having which is really deep fried and which causes a black discoloration in the food, is a cancer causing agent. Okay, and also n-nitroso compound, it also present in air, water, food, it can be anywhere. So to prevent all these, a proper balanced nutrition and taking more of antioxidant, phytonutrients and polyphenols are really important. This should be included on regular basis to prevent the exposure to and to prevent the risk of cancer. Okay, and what are the other endogenous factor? Obviously inherited, the families having a strong history of cancer, then there's a chance of getting cancer, but this can be prevented by having a proper diet and lifestyle. Okay, and if you say that my family is not there is no strong history of cancer in my family history, so will I get cancer or will I get affected with cancer? No, we cannot say it that accurate. We are exposed to all the endogenous factors and also exogenous factor. Anybody might get cancer if the lifestyle is not really proper. Okay, so we have to think like, is my lifestyle is really good? Am I having a balanced diet? Am I leading a good moderate activity lifestyle or a very good lifestyle? So this will prevent the risk of cancer. Okay, so moving on to the risk, it's about 50 percentage of the cancer cases can be preventable, because if you stop smoking, there is higher chances of preventing lung cancer and also the esophagus cancer. So if you stop alcohol, it will, it's really important to prevent, the alcohol consumption, because the acetaldehyde which is present in the alcohol, that will causes a carcinogenic effect in our body when it is exposed for a longer period of time. Okay, so this alcohol, if you start drinking alcohol by the age of 20 or 25, you might get exposed to cancer by the age of 30 or 35 if you are really sedentary and not having a good proper diet. Okay, there is also something called as GRAS, that is generally recognized as safe or upper limit, or this is the average intake which you have to consume in a day. So there is something called as all these, which you have to take in specific amounts, which is not harmful for the body. So even for alcohol, there is something called as the upper limit, which is to be followed to prevent the risk. It's not like preventing, you can delay the occurrence of cancer, because anything when it's exposed, it is dangerous for the health. Okay, so and 5% from the UV radiation. As of all we know, it's like more of vitamin D deficiency all over India. Most of them are deficient in vitamin D because of, even though we are exposed to excessive sunlight, the latitude and the climatic changes differs in India. So one example is that when I was taking a class for the SAG police personnel, we all know that police personnel will stand under the sun for more than 4 to 5 hours in a day. So if I asked the personal, I mean the police inspector, he told me that he was checked for the vitamin D deficiency and it was really low. Okay, even though he was standing for more than 4 to 5 hours, that vitamin D hasn't absorbed inside the body. Why? Because there is no healthy fat, there is no proper diet which has been followed. So we all know that there is something called as cholecalciferol and 1 to 5 cholecalciferol, which has to be converted into its active form of vitamin D, D3 to D, to get the adequate amount of vitamin D levels, right? So even though if you are exposed to more of UV radiations, the sun exposure, if you don't have a healthy fat or healthy cholesterol which is present in the body, this will cause deficiency in vitamin D. So prolonged deficiency of any particular nutrient might cause cancer effect, right? So these everything can be prevented. The only thing which we have to do is having a proper lifestyle, right? So this is something called as caution up. These are the early warning signs of cancer. So change in, if you identify anything from this caution up, you have to immediately check or screen for the cancer screening techniques. Okay. So first is change in bowel or bladder, anything, a lesion that doesn't heal for a longer period of time, or unusual bleeding or discharge from any part of the body, or any thickening or lump present in the breast or testicle. Or you can also examine yourself while having a bath, so that you can identify if there is any unusual changes which happens in your body, so that this can be prevented then and there. And indigestion or difficulty in swallowing can be because of gastric cancer or esophageal cancer, larynx, pharynx, it can be anything, okay? And obvious changes in wart or mole. This obvious changes in wart or mole, we know that there is something happening inside our body. So because of that changes, this unusual changes happens, okay? And nagging cough or persistent hoarseness. And you have to, if you have any unexplained weight loss or pernicious anemia, if people who have pernicious anemia or people who have gastric cancer are more prone to other types of metastasis. Okay. So what can be done? So what is the holistic approach for the cancer prevention? First is the vaccines. So Government of India, we know that there are vaccines to prevent cancers, and I will be explaining that in the future slides. And cancer screening is also available, which can be done during that particular age to screen yourself to prevent the risk of cancer, so that you can detect it in the earlier stage itself, and we can prevent the complications of later stages of cancer. And maintaining a healthy body weight, you should be your nutritional status should be proper, and you have to do a mindful eating, and you should be physically active as well. So you have to avoid exposure to environmental agents and social habits like tobacco, chewing pan, or smoking, or alcohol, anything like that. So preventing all these exposures, this is the holistic approach to the cancer prevention. So first, talking about the cancer screening tests, there are some early detection which can be done. So first is for breast cancer, you can do a mammography. So it is really important for postmenopausal women to scan for the breast cancer. Okay, and this can be prevented if you breastfeed the baby properly, and if you have any hormonal issues like PCOS or thyroid or any diseases that is related to hormones, you have to check yourself at least 6 months or 3 months once to see that your levels are normal. Okay, if you keep on on irregular medications or irregular dietary habits, this will causes breast cancer or cervical cancer. Okay, and cervical cancer, there is something called as pap smear test. where it is a non-surgical procedure where the vaginal discharge is taken, and that will be sent for the test to identify whether there is any human papilloma virus present. So this can be done at more than 30 years old people. If they are screening or taking any HPV vaccine, they have to test for pap smear test, and then they can go for HPV vaccine. Okay, so this will usually for the cervical cancer, the symptoms and the signs will show only in the later stages of cancer. Okay, so what you can do is you can take this pap smear test, and you can also take HPV vaccine, so that we can prevent the cervical cancer by 90%. Okay, so this is really important for all the women's out there. And next is colorectal cancer. Colorectal cancer, we all know that this insoluble something called as fiber, which is insoluble and soluble fiber, is really important to prevent colorectal cancer, and avoiding exposure to red meats and smoked meats and all the non-veg foods which are exposed to highly fried foods. These will prevent colorectal cancer. Okay, so there are more researches which has been proved that less exposure to red meats, preserved and processed meats, and increasing the fiber intake in the diet will prevent colorectal cancer. Okay, to identify colorectal cancer, you can do a fecal occult blood testing, so that there is any ulcerative colitis or any bleeding which is happening inside, or unusual cells which is there inside. So that will be tested via fecal occult blood. And other than that, colonoscopy or sigmoid test or CT, which can be done to identify the early detection of colorectal cancer. And next is lung cancer. It's basically low dose of computer CT which has been done, and also the breath test will, the lung capacity or the breath test will be detected for the lung cancer to identify how much capacity they have. Okay. All right. So moving on to the food and nutrition, there is no single food that will protect you against cancer by itself. Okay, we all know that. As a nutritional professional, as a dietitian, we all know that there is no single food which help to prevent or cure any kind of diseases. Right? It is a holistic approach of a balanced diet, eating more of antioxidant, eating more of colorful fruits and vegetables based on NAN Smart Plate or based on our food pyramid, that will help to meet all the nutrients which is required for that particular age to prevent all these type of communicable as well as non-communicable diseases. So, but research have shown that a diet filled with variety of vegetables and fruits, whole grains, beans, and other plant-based foods helps to lower the risk of many types of cancer. There is also laboratory studies which shows that consuming more of a good amount of vitamins, that is micronutrients, are really important, which is reluctant as of now, right? Everybody will look into the carbohydrate, proteins, fat, only these three macronutrients they will identify. They will not look into the micronutrients. So as of our part is to counsel about the importance of micronutrients like vitamin C, vitamin E, selenium, zinc, and all the antioxidant which is present, like phytonutrients, carotenoids, and quercetin, coenzyme Q10. These are some of the phytonutrients which is important, and this should be, tell to the patients or tell to the people to create awareness to prevent these types of risk factors. Okay. All right. So the next, let us talk about antioxidant. As I told you, so antioxidant is basically the word itself says it antioxidant. Oxidant is basically the free radical scavenging which happens that increases or damages the body's cell and the body's immune system, and also it increases the inflammation in our body. Okay, this antioxidant will prevent the free radical scavenging, and it will prevent the cancer causing agents. Okay, because why this antioxidant is important, because on a regular basis we are exposed to all the risk factor which we have discussed before. So continuous exposure to risk factor, to prevent all that, we have to take adequate amount of antioxidant on a day-to-day basis. It's not like I took for a month and after that I got affected with something. That's not like that. you have to take on a regular basis. You have to include more of colorful fruits and veggies, rainbow colors fruits and veggies in your diet to prevent these risk factors. Okay, so studies suggest that people who eat more of fruits and vegetables containing these antioxidants have lower risk of cancer. So clinical studies of antioxidant supplementation, even people will come and say that I don't have time for eating vegetables and fruits. So shall I take any supplements like multivitamin supplements or in specific beta carotene supplement or carotenoids, vitamin B6 or anything like that? There is no specific study which says that these nutritional supplements will prevent the cancer. Okay, it's like a holistic process. We all know that one wholesome food contains not only one type of nutrient, it is wholesome of all the other benefits too. Okay, all the other nutrients also. So it's better to take it as a wholesome fruit rather than specifically identifying that particular nutrient and taking it for the prevention of cancer. So that will not work. Okay, the balanced diet and having a wholesome foods and vegetables which will have a prevention of cancer. So what are the antioxidants? What are the nutrients which are important? First is vitamin E, which is tocopherol. So we all know that vitamin E is a potent antioxidant which is present in your oils. It's a fat soluble vitamin, right? That is in your oils, your nuts and seeds, your whole grains, green leafy vegetables, and you can also have all the nuts and seeds which is present like walnuts, almonds, hazelnuts, and it's really important. You can also have peanuts. So this will also help you to include vitamin E and meet the requirement of the daily needed portion. Okay. And what is vitamin C? Vitamin C rich foods, as this is a famous vitamin which is moving around. Uh,
Chandni K, can you please unmute yourself? Sorry,
So
mute
vitamin
yourself.
C is the major part of the nutrient which is moving around during COVID period. So it is also called as ascorbic acid, which is a potent antioxidant which helps in increasing the WBC count, okay, in the body, which helps to promote the immune system by strengthening it. And to prevent infections and other illness. Okay, so a simple thing to meet the requirement of vitamin C in daily diet is to having one guava per day, because one guava will meet 100% of your requirement. That is 40 mg of vitamin C is met by having one guava. And you can also take 2 to 3 gooseberries in a day, which is also really good in vitamin C. And you have to tell the people that vitamin C is a water soluble vitamin, and when it is exposed to heat or exposed to water, that will get that will not get absorbed, and it is a water soluble vitamin, obviously, right? So people will come and say that I'm having a glass of lemon tea in the morning. So hot, having lemon juices in a hot water and having it, saying that I'm having my shot of vitamin C, it's not really adequate. So vitamin C will not get absorbed, or it will get destroyed when it is exposed to high temperature, right? And also there is you can include more of green leafy vegetables, which is really good source of vitamin C. And you can include more of citrus fruits. And it's not like if I take citrus fruits, I might catch cold. It's not like that. Okay, it's basically depend on individual to individual, and there is no proper research which says that having citrus fruits might cause cold or cough or something like that. Okay. Next is beta carotene, which is the pro-factor of vitamin A, important for the immune system. Okay, important for the boosting the immune system, which is present in carrots, green and orange, and these kind of fruits and vegetables can be added on your regular basis to meet your beta carotene, and also the lycopene. Okay. So what are the other important compounds or important enzymes which is really important for the cancer prevention, like isoflavones, lycopene, which is present in the tomato, outer skin of the tomato, catechins, ginseng, and cucurbitacin, And capsaicin is really important to prevent colorectal cancer and also the gastric cancer. So when even that, when it is taken in excess, that will cause gastric cancer. So it's like a vice versa. We all know that food is medicine, right? If it is taken in excess, that will have a separate impact on our health. Okay. So these are some of the research, papers which has been published in 2019. The role of phytochemicals in cancer prevention. So if we see, these are the nutrients which is important, which has shown to prevent cancer. Okay, what are the anti-cancer mechanism? So one small example is lycopene, which we all know it's a pigment which is present in the tomatoes, papaya and pink grapefruit, guava, carrots. So as I told you, it's not like, I told you papaya, pink grapefruit or guava, which is a good source of vitamin C. It's not only vitamin C which is going inside, it's also lycopene or other micronutrients, vitamin A, which is going inside, which will have a holistic, benefit in our body to boost our immune system. So it prevents prostate cancer, breast cancer, cervical cancer, and many more which have not been identified as of now. Okay. So what will do is that is a dietary antioxidant. It is an anti-angiogenic effect, has an anti-angiogenic effect, inhibition of TCF signaling. So this is basically the DNA signaling which has happened that causes the metastasis of cancer. So these metastasis signaling and converting it into a carcinogenic cell, everything will be prevented by a dietary antioxidant. Okay. So these are some of the extracts or some of the polyphenols and phytonutrients which has been proposed in a study of phytochemicals in cancer prevention. This is a review article. So basically, if you see these cranberry extracts or blueberry extracts, carotenoids, selenium, vitamin E, so all these will significantly reduces the risk of all the cancer, okay, types of cancer. And you can also see quercetin, coenzyme Q10, resveratrol, which is present in green tea and grapes, which are really important for the prevention of colorectal cancer, pancreatic cancer, and breast cancer. Okay, so these are the simple. I'm just these are some of the in depth of phytonutrients. I'm just running through the slides. Okay. So, what is the summary of all those phytonutrients? Is that you can easily tell the patients or create awareness about having more of rainbow color fruits and vegetables, right? White, green, yellow, orange and yellow, red and purple, and which has good amount of phytochemicals like allyl sulfides, which is present in onion, garlics, leeks, and also sulforanes or indoles, which is present in cabbage, cauliflower, Brussels sprouts. You can include more of, if the patient of the people is affected with thyroid, we have to look into this specific cabbage, cauliflower, broccoli to be avoided. And also they can cook, even though these are ancient old guidelines which says that thyroid people have to avoid this cabbage, cauliflower, and broccoli. It's not like that. If the cabbage, cauliflower, and broccoli taken in small quantity, and if it is cooked, that goitrogen present in it will be destroyed. So the researchers and the development in the nutritional field is really developing, and we have to be updated so that it will be easy for us to counsel or tell the client or patients to include all of these nutritional foods. Okay. And lutein, zeaxanthin, these are the two main important phytochemicals which are abundant in pumpkin, lemon, capsicum, spinach, papaya, and pineapple, and also other yellow and green leafy green vegetables and fruits that will help to increase your antioxidant level in the body. Okay, so these are some of the anthocyanins, polyphenols, lycopene, as we have discussed this before. I don't want to go in depth. So these are some of the foods which is rich in all these phytochemicals. So including all these in regular basis will help you to prevent the risk of cancer. So now we have spoke about what are the foods to include, what are the phytonutrients, what are the nutrients that will help you to prevent from cancer. And now let us see what are the foods to limit. So a lot of us know that as we grow up, we all know that these food products should be limited, but it might be okay to eat sometimes, but these are not really necessary. Think once or twice, before starting any habits or any change in lifestyle or dietary modification. Before starting that, think before you do it, okay? Because as of we know that changing from modern lifestyle, we are really exposed to all these instant foods, processed food, preserved foods, which is really time consuming and time saving, which will be happy for all the working women and everybody to adapt to that particular dietary habits, which is not really safe. For longer run, it will impact your lifestyle. Okay, so if I say alcohol, if taken in excess, that might cause lung cancer, liver get affected. It can be alcoholic fatty liver or non-alcoholic fatty liver that will get progress to liver cirrhosis, that might damage the cells of the liver and might land up in the carcinoma, right? And after that, the processed meat, which they will use more of a salt, sodium chloride or sodium, to preserve that processed meat. This will causes gastric cancer in our body. Okay, so as per WHO, it's just 5 grams per day and not more than that. You're not supposed to take. Basically, as of Indians, we take more than 15 grams per day average. Okay, including the visible and invisible salts. But taking more of processed meats, that will add on to your salt intake. Excess. Already, it's in excess. If you add these foods in your diet, this will add on to excess of sodium intake that might cause different types of cancer, mainly gastric cancer and colorectal cancer. Okay. So other than that, red meat, beef, pork, as we have already discussed, the HACs or PAH, which is a chemical that is formed when you grill or deep fry the red meats. Okay, so we have to avoid all these exposure, as we know that these have cancer causing agents. And other than that, sugar sweetened beverages. So everybody will think that if we take more of sugar, and that might leads to cancer. That is correct, because calorie surplus that will causes obesity, overweight, all the metabolic diseases that will affect your gut integrity, affect your gut microbes, which leads to other complications that might land up in cancer. So that will also affect your immune system. So other than this, if I stop the sugar products totally, will I be prevented from cancer? It's not like that. You also have some external factors, as we discussed. There are many cancer exposures which is around. So taking, limiting your sugar intake, as I told you, limiting the high saturated fat, high in salt, sugary foods, and taking more of balanced diet with antioxidant, a good amount of fruits and vegetables will prevent. Okay, although studies shows that saccharin and some artificial sweeteners will cause cancer effect, but some research shows it will not. The basic thing which I would like to say here is that saccharin or other artificial sweeteners will definitely, for a longer run, will definitely causes gut dysbiosis. So if gut dysbiosis happens, what will happen? Our gut integrity, the epithelial lining gets damaged, and all the microbes which is present, good or bad bacteria which is present, will pass into the lymphatic system. That will affect the immunity totally. And if you're not eating, and if your nutrient status is not really adequate, what will happen? That might help the cancerous tissues to grow inside and multiply, and it will start replicating. Okay, so these are some of the long term process, but this can be prevented from childhood, so that the risk of cancer can be prevented. So this is a research paper, which is a review of World Cancer Research Fund and American Institute of Cancer Research, which have shown a strong evidence of what are the exposures and what are the effects and the outcomes of the cancer. Okay, so first one is the greater body fatness. Greater body fatness is basically increases the risk of all the cancer. Okay, so we all know that obesity, if the fat mass, the visceral fat mass is high, the organs will not function properly. It might lead to metabolic disease like type 2 diabetes, cardiovascular diseases, or other intestinal diseases, which might lead to severe illness. And that will also affect your hormonal levels, which is important: the estrogen, progesterone, your leptin, ghrelin, and the cortisol, melatonin, which is really important for the overall functioning of the body, gets affected. That causes thyroid cancer, endometrial cancer, breast cancer, or ovarian cancer, which mainly evident for the menopausal, postmenopausal women. Okay, so preventing, maintaining a healthy body weight is also really important. Not only that, having a healthy, proper ratio of muscle mass and a fat mass is equally important than looking on to the overall physique of the person. Okay. Next is physical activity. So physical activity decreases the risk of colon cancer, breast cancer, endometrium, because physical activity boosts your hormone levels. And physical activity, doing regular physical activity, will also help you to prevent from constipation. Most of us, nearly like 60 to 70 percentage of the people all around, as they have moved into a sedentary lifestyle, they are having issues like constipation, sticky stools, and improper bowel movements. Okay, to prevent all this, simple as that, having more of whole grains, having a good diet with insoluble fiber and proper ratio of resistant starch, that will help you to prevent constipation and also prevent colorectal cancer. Okay, so taking whole grains decreases the risk of colorectal cancer, as evident. There is also a research which has been proved. And foods containing dietary fiber decreases the risk of colorectal cancer. And fast foods increases, obviously, extra calories, empty calories, will causes weight gain, overweight, obesity, all the metabolic diseases come into play. It's like a vicious cycle. Okay, we have to remember like that. It's like a vicious cycle. So if you start with, if the diet is not proper, if your lifestyle is not proper, it causes your weight. Weight is the first thing which will be increased, and after that, all your metabolic diseases, cardiovascular diseases, everything will come into play. Okay, and avoiding red meat will decreases the risk of colorectal cancer. And processed meat, sugar sweetened drinks, so whatever I told you in before, it has been summarized overall, right? And also the main important thing is that we have to tell the mothers to breastfeed the child properly to prevent postmenopausal ovarian or cervical cancer, or endometrial cancer, or breast cancer. Okay, so we all have that prevention, what ought to be advised for the patients, or what ought to be followed throughout our lifestyle to prevent, but we are not doing the same. Okay, so these are some of